Beneath the calm flow of this river, the quiet pond, and the gentle waves of this lake, tiny tadpole like parasites lurk, ready to enter the skin of a woman, fetching water or a man out fishing. The result of this silent invasion is the breakdown of a woman's reproductive health, her dignity, and her peace of mind. On December 2nd, 2024, Florence Wakesho, a medical parasitologist and public health expert at the Ministry of Health, published an opinion in the Daily Nation highlighting findings from a collaborative research on female genital schistosomiasis conducted with LVCT Health and Frontline AIDS and funded by the Children's Investment Fund Foundation. She noted that of the 2,714 women who underwent cervical cancer screening in 3 schistosomiasis endemic counties of Kwale, Kilifi, and Homa Bay since April this year, 11% had FGS.
But she didn't go for any medical attention. Then they did.
Loza is one of the many women in Homa Bay who has suffered from this disease. We've changed her name to protect her identity and spare her the stigma. The World Health Organization identifies FGS as one of the neglected tropical diseases in the world. Sadly, in Africa, it affects 56 million women and girls who depend on fresh water from lakes, rivers, ponds, and swamps. The symptoms Loza describes align with those recognized by the World Health Organization as indicative of FGS. But how does female genital schistosomiasis begin? Female genital schistosomiasis is caused by a parasite called Schistosoma hematobium. It enters fresh water through human urine or feces and begins a life cycle that depends on a freshwater snail, the Belinus species. Inside the snail, the parasite multiplies. Once mature, it bursts into the water, ready to infect its next human host. Many women live with the disease for years, unaware of its cause. In health facilities, it's often mistaken as a sexually transmitted infection, delaying proper diagnosis and treatment.
We usually learn about schistosomiasis in school. So when we come out here, it is a little bit forgotten. So what is coming into our mind is bilharzia, when someone is passing urine in a stool or even in urine, passing blood, in urine. So apparently, I thank LVCT for having brought this. It was kind of a sensitization. It's like we've been doing a misdiagnosis to our clients, because when we think about STI only, you treat this woman like 3 or 4 times with the same diagnosis but different drugs without any results, then it's like there's something amiss. So I'm not blaming the healthcare providers that are still thinking in this line.
To diagnose female genital schistosomiasis, a visual examination of the affected areas is required.
So this woman may have rubbery papules on the cervical wall or just on the around the cervical os. The woman may have also yellow sandy patches. So they're just patches on either the wall of the vagina or the wall of the cervix. They're just patches like sands, or homogeneous yellow patches. They are just spread. Homogeneous is like they have a defined. You can really see the spread. Yeah. So you have to see it. So they also blood vessels, so they are engorged. So you'll see, like when you're doing a speculum exam, you see the cervix is reddened, like inflamed. Someone may even start thinking that could it be that someone hit the cervix or what? So initially you'd find most healthcare providers would say someone is having cervicitis, that is inflammation of the cervix, not knowing that it could have been FGS. Yes. So we can have those abnormal blood vessels around the cervix, the cervical os, or just on the cervical walls. The cervical wall. And also even foul smell discharge.
If positive, they are given a single dose of Raziquantil administered depending on one's weight. However, there are home-based solutions that women can apply to eliminate the exposure to the parasite.
Reducing the risk starts with how one ensures that they urinate. So if one is urinating at rural setup, we have latrines. So we inform the community through the community health promoters and also their leaders that people should have latrines where we can have people urinating and not in the water sources, the open water sources. Same applies to defecation. So that is the first point. Because the bilharzia, or rather the snail, will also be at peace when we don't do open urination or defecation, because it's just housing the worm. Otherwise, the snail will also be at peace. So that is the very, very first point on preventive measures. Then coming now to someone who has already been infected and maybe wants ways of how to reduce the risk of reinfection. One, if there are people who are, say, planting rice or their plantations have flooding we advocate them to have gumboots. That is one. If it is the water and this water they can't avoid using it, like maybe the water pans or the lakes, we advocate that they draw water from the lake. After drawing water from the lake, carry it home instead of bathing inside the lake. Carry the water home so that you can put it to settle for, say, 2 to 3 days. And that means someone should have more water containers, maybe in form of jerry cans and the rest, which are enclosed, because the worm will not survive in these containers when it's exposed to, say, sunlight for some time. When it is confined in a closed container for some time, it will die naturally. Or after drawing water from the lake or the river or from the water pans, and there's some source of fuel like firewood, they can boil the water. When they boil the water, the worms will be killed naturally.
Female genital schistosomiasis isn't just a health issue. It's a sign of deeper problems, lack of clean water and unsafe sanitation. In endemic counties, women are still exposed to infested water daily. Until that changes, they'll keep suffering quietly, even though the Constitution promises every Kenyan the right to a life of dignity and health.